Hi, welcome to Ideal Health Now. We are so glad you're here. I'm Dr. Kay Chandler. I'm a gynecologist at Cornerstone Clinic for Women in Little Rock. I've been in practice for 15 years. Over the last 5 or 10 years, I've really focused on trying to help my patients be healthy and to get off medications and to just do things that are preventative for their health instead of reactive for their health. I've struggled with patients trying to help them find ways to lose weight. I've seen patients that have done multiple weight loss programs, exercising maybe an hour, hour and a half a day, and come in and say, I can't lose weight. Is it my hormones? Is it my thyroid? You check these things and they're normal. Well, recently in the fall of 2010, I became aware of a program, Ideal Protein. I became aware of it through some patients who had done it with another clinic in town and had great success. And these are people that I have been working with for a couple of years trying to help them to lose weight. So that is why we're here. We are here with Ideal Protein, Ideal Health Now Clinic. And why is because it works. So these are some statistics on obesity. This is showing you where we are. And they're not pretty. 2 out of 3 American adults are overweight. 1 in 3 United States children are overweight or obese. You can read the rest. This is the problems that I see every day, and this is why we need to do something to make a change. Metabolic syndrome component in the United States. 53% have abdominal obesity, 39% high blood sugar, 40% hypertension, and many with low HDL and high LDL. These are scary statistics, but they are statistics that bear true and that we see every day. What is the problem behind these underlying health problems? Why do so many Americans struggle with obesity, hypertension, high cholesterol, high blood sugar? The culprit is sugar. All carbohydrates become sugar. Each 4 grams of carbohydrates equals 1 teaspoon of sugar. In fact, this Coke has 65 grams of carbohydrates. That means it has about 14 teaspoons of sugar. This is a major problem in our diets today. All carbohydrates become sugar, as I said. Some, however, are healthy, good carbohydrates like fruits. Some are fast-burning carbohydrates like refined flour and pasta. You may be dealing with bad carbs such as Cokes, candy, or even slow-burning carbs such as vegetables and whole grains. But all carbs do become sugar. In the year 1905, North Americans ingested about 5 pounds of sugar. By the year 2009, North Americans ingested much more sugar every year. The grand total, 150 to 200 pounds of sugar. Now, I know that's probably hard to believe when you first hear that, but if you think of this as 14 teaspoons of sugar, and how many Cokes a day do many of us drink? That's not hard to imagine, is it? So we find ourselves in the middle of a modern day epidemic. Syndrome X, or metabolic syndrome. At the center of the X, or the root cause of Syndrome X, is hyperinsulinemia. That is a result of too much insulin put out by the pancreas in order to deal with the carbohydrates that we're taking into our bodies each and every day. The problem is in modern day medicine, we treat each of these problems individually. We might put you on a statin drug, lovastatin, Lipitor, something like that for your high cholesterol, a blood pressure medication to bring down your blood pressure, a medication to bring down your blood sugar, such as metformin or sometimes even insulin itself. And then for the abdominal obesity, we would say eat less and exercise more. The problem is that these are treatments and they will improve your quality of life and improve your length of life to take these medications. However, they are a treatment, but they're not a cure. You must cure these problems that began with food.